Hmm.
Is that Dolly in the background? Looks like it.
Dawn, it's 9 and we have a quorum, so you're good to call the meeting in order.
Okay, good. Okay, good. I was checking the list to make sure we had a quorum, so thank you for that. Welcome, everyone, to the regular monthly meeting of the Kansas Children's Cabinet. I want to thank all of you for joining in this morning. We will be respectful of your time, but we do have a very packed agenda, so fair warning on that. And with that, we better get started. First order of business will be approval of minutes. We actually have 3 minutes, sets of minutes to approve from the regular Children's Cabinet meeting on October 6th, the board retreat on that same day, and then the special meeting by Zoom on October 19th. I think what we'll do is we'll walk through these one at a time for consideration of any changes or updates, and then we will adopt or approve all 3 sets of minutes with one voice vote at the end. So first one up would be the regular minutes for October 6th. Any discussion, any updates, corrections? All right, hearing none, move ahead to the special cabinet retreat, also on October 6th. Any updates or corrections on the minutes? Seeing and hearing none, we'll move ahead to the special meeting on October 19th, single purpose meeting for approval of Capital Projects Fund accelerator grants. Any additions or corrections there? All right, seeing none, I would entertain a motion to approve all 3 sets of minutes.
Monica, move to approve.
This is John.
I'll second.
Go for it.
All right, motion has been made and seconded to approve the minutes. All those in favor say aye.
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 Opposed, no. Okay, the minutes are approved. Moving ahead to the possibly the biggest item on the agenda, approval or discussion and approval of the annual report. I'll turn it over to Melissa and she will hand it off to Jessica Sprague-Jones from KU.
Thank you, Dawn, and it's nice to see everybody this morning. I am really pleased. This is always a good meeting when we bring you the annual report and offer the chance for you to give thoughts and make any additions or corrections that you see in the report before we move it to before we adopt it as our official report in compliance with statutory requirement to report to the governor. So you saw in the draft that we sent at the beginning of the week, it covers the scope of our work this calendar year, and Jessica will do a high-level overview of the sections on screen. I won't step on her toes, and I won't take a lot of time at this moment to offer any additional insight. I'm just going to invite Jessica to join us and walk you through the report.
Thanks, Melissa. Good morning. So my name is Jessica Sprague-Jones. I work for the Center for Public Partnerships and Research at the University of Kansas, where I have had the pleasure and privilege of supporting the Children's Cabinet on a number of projects over many years now, including being part of the big team that has developed this year's annual report. So the goal for this report every year is to report on the full scope of the Children's Cabinet's work for the year. There are many reports to you over the course of the year on individual projects that are then captured in this report. So this is really kind of the shoring up of all of the work that has been done. Always a big job, maybe particularly a big job this year because there was a lot of work done. There are 4 sections in this report: our progress, data for impact, our children's future, and recommendations. So we start out with this funding graph that I think is a pretty reasonable snapshot of the work that was conducted in 2023. This central bar is what I might be tempted to call Children's Cabinet Classic, right? Like these are the funds that the Children's Cabinet has overseen for many years, the CIF principally, and also community-based child abuse prevention, which is a federally funded program. In the last several years, the preschool development grant has also been under the Cabinet's purview. This year, that took the form of both a planning and a renewal grant. And then to the left here, you see this large distribution of funds to Childcare Capacity and Capital Projects Fund Accelerator that was unique to this year. Next slide, please. The first section of the document, Our Progress, the bulk of it goes to profiles of the programs that the Children's Cabinet oversees. So Children's Initiatives Fund programs, the Early Childhood Block Grant, and community-based child abuse prevention. The Children's Initiatives Fund, the CIF, is the fund that Kansas somewhat uniquely created out of their tobacco master settlement agreement funds in 1999 and charged the Children's Cabinet for overseeing it. In 2023, this fund funded 10 programs in the areas of early care and education, early intervention, maltreatment prevention, and tobacco use prevention. The profiles in the report include for each of these grantees, program descriptions, population served, and some impact data. This graph depicts the total distribution of the CIF. So vertically, it's organized by administering agency, and then horizontally, the programs within that agency. This section also includes details of the CIF accountability process, which my colleague, Dr. Owen Cox, presented to you earlier this year in great detail. This, one of the things it includes is just kind of information about the process itself, the research questions, that kind of thing. It also gives some detail about each individual program's evaluation practices. The accountability process itself is in some ways best understood as an evaluation of the uses of the fund. Each of these programs have their own rigorous evaluations that then feed into that accountability process. It also includes some key takeaways that research team identified through collecting all these data from these programs that really applied across the programs. Top key takeaway is that these programs are effective and they are needed. Lots of evidence to support that. Also, many of these programs identified that many families are struggling to meet basic needs over and above the services of the program. So this includes food security, affordable houses, and housing and health services. Also, again, I believe this was a finding of previous year as well, is that finding and retaining staff is a persistent challenge across programs. And finally, many programs this year highlighted the need for additional mental and behavioral health support for children, families, and also program staff. There's also a section on ECBG, the Early Childhood Block Grant. This is a block grant that is funded by the CIF and directly administered by the Children's Cabinet that provides services to at-risk children birth to 5 and their families. So the section includes information on service areas and types and on all individual grantees. WSU conducts the evaluation of ECBG, and Dr. Lynn Trefferman presented a very detailed account of evaluation findings for this year to you earlier. So we really just include impact measures per grantee and also just some information about the common measures used to power this evaluation. This section also includes some descriptive analysis that actually came out of the first authorized project of the Kansas Early Childhood Data Trust. So as you may remember, that project is really principally concerned with linking early childhood data, principally ECBG, but also CBCAP data to child welfare data to understand the impact that early childhood intervention has on preventing removal into foster care. As part of that, though, that research team had access to historical ECBG data, and so did some descriptive analysis. Really, one of the key stories that came out of that was, I mean, as you can see, it's a 2020 story, right? It's a pandemic story. Consistently over the last several years, you've had ECBG serve slightly over 5,000 kids, but a really pretty dramatic dip in 2020. And what may or may not be clear from this graph, but certainly is clear from the data, that is that Hispanic children and African American children were probably hardest hit or disproportionately hit by that. They were even less likely to access ECBG services during 2020 than the rest of the children served by this program. Now, that has certainly recovered in the last couple of years since. And overall, the trend is that ECBG has increasingly served a more diverse population of children. There is finally a section on community-based child abuse prevention program. This is a federally funded program focused on preventing child maltreatment before it starts, for which the Children's Cabinet serves as the state lead agency. It was funded totally about $2 million in 2023. And there are 12 grantees being funded, offering a really wide array of services, which is typical of CBCAP as a whole. But it includes parent education, home visiting, case management, preventative legal services, and resource centers. And that's not even an exhaustive list of what is offered in Kansas. The CBCAP evaluation for the last couple of years has been made up of two components. The first component is the Protective Factors Survey, second edition, PFS2. This is a validated survey designed nationally for CBCAP evaluation. It's peer-reviewed and it measures multiple protective factors in a single short instrument. It's a voluntary survey and it's completed by caregivers about their own experiences. And in addition, in Kansas, all of the programs field the retrospective version of the survey. So it's generally asking parents to reflect back on their experiences of services and the impact it's had on them and their family. Also, in the last couple of years, the CBCAP evaluators have engaged in a process of ripple effects mapping. So this is a qualitative participatory evaluation approach that engages providers, participants, and community partners in shared data collection analysis. And the process goes that these groups get together and they interview each other, come back together, and kind of share what their insights are about their experiences and what they've discovered together, and together kind of build meaning from that. For 2023, from the Protective Factors Survey, parents reported 55% increase in family functioning and resilience, 43% increase in nurturing and attachment, 56% growth in social supports, and 41% growth in caregiver-practitioner relationship. This particular subscale is designed to look at how a parent feels about the process of getting services, their relationship with the service provider, and the context of the program. The ripple effects mapping really found that was intended to contextualize and make greater meaning of those results and why the results are as good as they are. They really stressed this year a continuum of care that is being facilitated by these programs. So that's community spaces that act as a gathering place for children and caregivers, case management and service navigation, support accessing basic needs, parent education to cope with the challenges that can come with difficult moments, building and strengthening communities of support. And this was really around the act of parents getting together and being able to create positive communities with each other from their interaction with CBCAP services, and legal support that prevent crisis and ensures family stability. This section also includes some information about all of the work the Children's Cabinet has been doing to address childcare and find solutions there. So that includes childcare capacity accelerator grants, childcare innovation communities, capital projects fund accelerator, and the work being done to elevate and support the workforce through the career pathway and the workforce registry. Going forward, we will be evaluating these efforts, particularly the childcare accelerator and innovation communities. Grantees are reporting monthly progress on facility slots and children served, and also quarterly reports on areas of particular interest, including workforce recruitment and retention, capacity to serve infants, and whatever they have identified as their own goals and barriers in doing this work. And evaluation results will be presented in next year's annual report. The second section of the document is called Data for Impact. Truly, there is data throughout this report. So this section is really focused on the bigger picture pieces of collecting data, really to understand things from a broader perspective than a program evaluation does, to understand the system of early care and education, and also the needs and experiences of children and families. So first up on that is the distinct count of children in early care and education services. This is the second authorized project under the Kansas Early Childhood Data Trust. This is a project that is working through multiple state agencies to develop an accurate and reliable count of children being served in ECCE programs. And a key output of that is a distinct count dashboard, which combines multiple sources of data into a publicly available and easy to use tool being launched this month. And you can see what the front page of that looks like in this image here. I believe Dioga pointed out that we were still crossing our T's and dotting our I's on some of these figures when this report went out. But I have gotten word that we can confirm that these are the accurate numbers for these service areas of childcare, pre-K, home visiting, and Part C. So I believe we got it right in the report. The next project described in Our Tomorrows is described in Data for Impact is Our Tomorrows, which is a narrative research project that collects stories and respondents' characterizations of their own stories in an effort to capture family experiences to learn how to better support families across Kansas. This year, the really key set of results was around the critical importance of trust. Quantitatively, respondents identified trust as the most important factor in seeking services, above things like cost of the service or who's providing it. So it's really the fundamental characteristic. And in the stories, the respondents really highlighted the importance and value of their own communities and connection in overcoming difficult experiences. There are a few implications drawn out from this set of findings in the report. One kind of, I'd say the fundamental implication of the entire Our Tomorrows project is the importance of family voices and experiences and how they should really be central to identifying and providing needed services. Also, this point that Kansas community life is a real strength and a source of support for young families, and there's an opportunity there to continue to build on it and support communities to build on their own existing social networks to provide multifaceted, flexible support for families in a way that's appropriate for their own context and their own community. And finally, future research should examine how community-driven approaches to family support affect child and family outcomes. I think that there is an interesting piece to be teased out there to understand how we can kind of ultimately, we understand that these families do prioritize, do appreciate their communities and prioritize trust. And that piece of how that ultimately affects both recruitment, retention of families, and ultimately their own kind of discretionary engagement in services and what the knock-on effects of that are for ultimate outcomes. I think it's interesting and it's important. Finally, in this section, there is information about a study supported by PDG, the Young Families Experience of Social Connection. This is a study that is responsive to the often observed, it's oftentimes called like a loneliness epidemic, and it's part of this trend we see across multiple indicators, and it's quite a durable trend of social connection and opportunities for social connection falling away, many different spheres of public life. So this is an opportunity to understand what does that mean specifically for families of young children, right? Like, I don't need to tell this group of people that early childhood is a critical time in a child's life and a time when that child needs an incredible amount of support. I think from a life course perspective, it's also just inarguable that this is a tough time, or can be a tough time for families as well, right? Like, just from a life course perspective, families of young children are younger themselves, right? As young as they're ever going to be, earlier in their own careers, probably have the fewest financial resources that they're ever going to have. So at a time when parents need to be providing the most for their kids, it's also the time that they need the most help in doing that. So what does this larger social trend of loneliness and lack of connection mean for that particular dynamic, which is always present, right? So we designed this survey to capture experiences, attitudes, and behavior of Kansas parents and young children related to social connectedness and support. I think a lot of results have come out of this that really have important implications for how we can better support families. Only 40% of these parents of young children said that they had someone they could trust for advice about parenting. 54% indicated they had no or not much opportunity to shape the direction of their communities on the issues that affect them. Majorities within childcare, majorities agreed that children were safe and learning in childcare. So that was two separate items. But 44% indicated that they could find someone they could trust to look after their kids on short notice. And 40% reported employers demonstrated high levels of support for caregiving responsibilities. And that was even slightly lower amongst our rural respondents. So I think there are a number of implications for these findings. And I think what we articulate in the report is that there's kind of a global finding here that we all have a role to play in supporting families with young children. There's no one body that should be solely responsible for that. So this piece about how many families could benefit from support for caregiving that's flexible and responsive, this piece about like access to trustworthy advice and options for accessing childcare when unanticipated situations arise. To me, these really they both speak to this idea that there has to be care and support that meets families where they are at their moment of need. It's also difficult for families with young children to civically engage and make their needs and desires for their communities known. Many people on this call have been very engaged in the project of engaging families to make their needs known for when it comes related to early childhood. But what is kind of that larger community of folks who might not be specifically thinking about the needs of young families when they are planning their public engagement events? And how can we encourage those folks to anticipate the needs of young families for child-friendly hours and spaces? And finally, employers are really critical contributors to child well-being through support for their parents. Lots of opportunities that employers can provide support for their employees in this manner, only some of which are listed here, and which really obviously the employment context matters, right? Like not all of these options are available or appropriate for every employer, but paid leave to care for a sick child, flexible and remote work options, and infant at work policies are just some of the ways that employers can help support their employees in their caregiving responsibilities. And then the final section is our children's future, and I will turn it over to Melissa.
Thanks very much, Jessica. I want to maybe just pause before we move into the look ahead to see if anybody wanted to ask questions of Jessica.
This is Delise. I don't have a question, but I did want to make a comment about the ripple effect evaluation that you guys are doing. I think that's a really smart idea. I think it's going to give us a really comprehensive look about what our challenges and our successes are and what our opportunities are. So kudos to you guys for looking into not just what the program themselves are doing, but what the effects outside of the program might be. I thought that was a really good idea.
Any other input from board members? I want to offer just one personal observation about childcare. Jessica, you did a great job of defining the challenge of providing childcare. It reminded me that when we had young kids of our own, Betsy and a couple of her friends founded they called it babysitting co-op. Today it would be childcare co-op. Primarily for during the school day when there aren't school-age kids to provide babysitting. You need to go to a medical appointment. You need to take care of personal business. So they set up a co-op so that they could call each other and find childcare on short notice. And I don't know if that was unique or is that fairly broad spread.
I can't speak to it other than the fact that I did that as well when I had my first baby, and I was a grad student at the time, and it was an incredible experience. But I have no sense of how prevalent it is as a practice.
We do see in some of our pilot funded projects or innovation communities and the like, we are seeing, and I know Child Care Aware of Kansas has a contract to provide a shared service model, and so we see those efforts starting to take root. Yeah, I think it's one of those things that is a very locally led initiative that becomes tough for us to measure at this level, but we do see signs that is going on around the state. And then I would point out that through our CBCAP program, we are funding in the Wichita area. One of our grantees operates a crisis nursery, so it is definitely an official facility designed to be a spur of the moment drop-in situation for families that just, you know, they have something unplanned, or there's a, you know, it might be because of crisis in the family, but it exists for that purpose, for that unexpected, unintended need for childcare. Well, if there's plenty of room built into the agenda for further discussion and input, but I will go on and get back on track with walk the overview of the final section of the report, which is our children's future. So we wanted to make sure to bring forward information about work that has gone on this calendar year that has a forward-thinking focus. We tend to really focus on here and now. It's easy to get mired in the needs of today, but when we don't look up and look around and take stock of where we're headed, we can sometimes get into trouble when we're designing solutions to those needs that exist. So I want to talk first about the Kansas Future Fellows Project. This is something that we have used PDG funding, and we just kicked off the third cohort of Future Fellows. So it is a fellowship that involves Kansans from across the state. There's usually, I think we've had roughly 10 per year. So we invited 31, which is all three cohorts, got together in mid-November to kick off year 3. The Future Fellows is a program designed to build and sustain a network of civic entrepreneurs across the state who are in a position in their daily work to impact the future of Kansas children and their families. So it is, you know, it speaks to issues like the social connection and isolation that families feel, especially, you know, across our rural communities, but even within a more densely populated area, families can end up feeling very isolated by the demands of raising their children. But we want to make sure that Kansas is an exceptional place to raise your family and do business. So the Future Fellows are always an interesting group of people who bring expertise outside the world of early childhood. So we intentionally seek people who are not childcare providers and early childhood program specialists. So we have a range of backgrounds across all 3 years that involve other types of business owners, attorneys, or ranchers, or we've had folks from local government. We've had philanthropic sector folks. We have really each year tried to make sure that the flavor of each class of fellows is varied and uniquely different, so that we can benefit from the knowledge and expertise they bring to the table and really plant seeds across multiple different policy sectors and industries. So futures thinking, strategic foresight, and innovative methods for futures thinking is a really interesting place to be. And it's actually, it can be invigorating when you do get the chance to look up and think about the future, think about those ripple effects, think about how decisions being made today by a local government or a business or whomever will set up a situation that has like a pebble in a still pond that has those ripples that take time to make their way across the surface. There's a wide array of methods in use with the Future Fellows that I can tell you about. I don't know that I can do a deep dive into what it all means, but I've done a little bit of this work myself and really found it to be a fascinating thought exercise. So we have employed methods such as signal identification to sort of discuss and identify signals of changes to come. So you might think about things in the news. AI is a big topic in the news. That will have effects. And when we take a moment to reflect on, 10 years from now, 20 years from now, where might we be? Those are signals that then get used through the process to make sense of the challenges that lie ahead and potential solutions that people might be thinking about. They are using something called a 3 horizons framework, which organizes inputs to imagine impact and identify interconnectedness through a toolkit that includes things like a futures wheel or systems mapping. So they get to dream and think and plan and imagine what could be done to make the future better. So it has been a really big bright spot in our universe to be able to mentor these cohorts of Kansans. And what we have found is that even the first group from 3 years ago has had a desire to stay connected to the process. So they all came together as one large group, as I mentioned, in November. So there's something to this that has taken hold in the folks that have participated, and they are sticking together and bringing new and different facets to the work each and every time they get together. So they meet 3 times a year and do kind of a 1 or 2 day deep retreat with each other and with specialists and consultants that bring different types of expertise to the table. And so we wanted to bring you an update on that. I've mentioned this at meetings throughout the year. I was invited to join the Early Years Climate Action Task Force. This was a national group of 20 early years leaders, climate leaders, researchers, medical professionals, parents, philanthropists, and a couple others who came together to really do a deep dive into the effects that our changing climate are having on young children. And it's been interesting. We did 6 listening sessions, all virtual, but we heard from people all across the country. I think what really resonated the most with me was the day we had a childcare provider who was from a small town in Central California, the heart of those major forest fires that raged a couple years ago. And we had a provider from the coast in Florida who had survived a severe hurricane. And in both cases, they talked about not just what you would expect to hear from them, that when their kids came back into their care, they were dealing with kids who were deeply traumatized by these extreme events. And they had a lot of work to do to deal with those very big emotions and help kids make sense of what they had lived through. And the logistics of putting their childcare businesses back together so they could care for those kids as quickly as possible. All of those things were expected. But one of the things that was really compelling was the provider from California mentioned that in the midst of the disaster response effort that was going on, the emergency response, she was the person in their community who could tell the first responders where our youngest kids who are not yet school age, where those households are in the community, because we don't have a network. We don't have a system for the way, when you register your child in school, then there is knowledge that child exists. For younger age kids, unless they're receiving a certain type of service, you wouldn't necessarily know where those children are living. So it was the childcare provider who was able to identify, hey, we need to look for a 2-year-old here and a baby over there, and et cetera. And the other providers kind of echoed that sentiment that those situations were very difficult. The report is available. We've put the website on screen. It's earlyyearsclimateplan.us. Flourishing Children, Healthy Communities, and a Stronger Nation is the title of the report. And really, the goal that we identified very quickly is that we are not scientists and climate experts who should be speaking to the science behind our changing climate. We are not dealing with causes or any of those types of issues. What we identified is too often children are not centered in the planning for dealing with this type of thing, with these severe weather events that are increasing in frequency, increasing in intensity. And so it is a report that is designed to walk policymakers at every level through best practices types of ideas, and help to really help focus on what a healthy, resilient future looks like for our children. So I'm pretty proud of the end result and the work that went into shaping it. The committee was co-chaired by Diane Ronner, who is the president of Start Early, and Antoine Ford, the president and CEO of Enlightened Inc., and the chair of the District of Columbia Workforce Investment Council. Very smart leaders, and it was an incredible roster of people to work with and learn from. And the process was spearheaded by the Aspen Institute. This is Planet Ed Project and Capita. So I encourage people to take a look at the report. They specifically did not print copies because they do care about the climate, and decided not to add printed copies to the mix. So it lives exclusively online. You can go to the next slide. The next project that occupied a lot of time and attention this year was the Early Childhood Transition Task Force. Governor Kelly established the task force with Executive Order 2301. This was, in fact, the first executive order of her second term, issued the day after she was sworn in. It established the task force and charged us with reviewing Kansas's early childhood programs to develop a roadmap for the creation of a new state cabinet level agency focused on supporting the success of our youngest Kansans. I will say that through the work of the task force over the course of the year, the recommendations that are moving forward are a little more open-ended, so that what we identified is the pressing need to realign and unify the governance of early childhood programs in Kansas. That can take several different forms. So the final recommendations are they're not this specific that it has to be this particular format. There are a number of different ways, and so the report recommends the governor and the legislature work together to follow a program realignment process. So there are the vision remains what you see on screen, that we want all Kansas children, especially those between 0 and 5 years of age, we believe they deserve healthy childhoods supported by a robust early childhood system that improves outcomes and effectively provides high quality early care and education, adapts to the needs of families and communities, and is equitably accessible to all communities across the state. We put another website on screen. It's the site where all of the materials relevant to every meeting held by the task force can be found. So when you and you can Google Kansas Early Childhood Transition Task Force and end up at this website. That's lots of backslashes in that address. But it's organized by date, by meeting date. And then when you click on the links, you can get all of the information about our agendas, who we heard from. The interim report is available. The draft recommendations are available from the October meeting. We can move to the next slide. What I wanted to highlight for you all today is that I wish the order of events was reversed, but we are meeting ahead of the delivery of the final report, which is slated for December 11th. We will deliver the report to the governor and hold our final meeting, and then the task force work is complete, except for helping inform people about the content of the report. That work will continue for members of the committee. The report will include a section that lays out Kansas context, and a section that summarizes the meetings that were held throughout the year. And then it moves into the recommendations that are broken into the 3 categories you see on screen. The programmatic movements that are being recommended, the logistics of transition. That is a process that can't just simply happen overnight, no matter what is ultimately determined. It will take some time to move major operations into different positions. But then we also have a section that really speaks to the metrics and data that we should be gathering and following, so that we make sure that the reasons for recommending this, the desired outcomes, actually are achieved. So this is all about improving access to services for families, streamlining the process of making sure that the intake process for families is easier, reducing duplication of effort, improving the effectiveness of our programs by streamlining and aligning things. So that you can see the actual draft recommendations for those 3 categories are visible in the October 18th repository of documents. I will say the October meeting was a work session, so members of the task force had the opportunity to bring thoughts and recommend edits and changes, and we voted on some things to adopt. So that's where I'm disappointed I wasn't able to deliver a final version of this report to you today, but I can confirm that what you see in the draft recommendations, the substance did not change much. We did a lot of reorganizing and wordsmithing, but the substance of what's being recommended will be what is visible on screen. So if we can move to the next slide. I want to call out what I think is the key recommendation in all of this is that Kansas should streamline its early childhood governance structure by consolidating early childhood care and education services into a single state entity, reforming our coordinated system into a consolidation or creation model. And I will flag for you one of the things that we wordsmithed is the word consolidate actually speaks to one specific form of governance. There are 3. There's coordinated, which Kansas currently operates. There is consolidated and there is created. And we wanted to avoid the impression that we were meaning the capital C consolidated model when we use the word consolidated. So this is an example of the kind of change that happened post October meeting based on the work group input. The terminology you see here is from the original recommendation. In the new report, in the final report, I believe that will say by unifying early childhood care and education services. So it is really designed to say we need to simplify things. We need to bring them together in an organizational structure that brings a greater clarity and simplicity to the operations. I do also want to raise for this board that there is a section of the programmatic recommendations that relates specifically to the Children's Cabinet. So the key recommendation says the Children's Cabinet and Trust Fund, their programming and operations should be embedded in the new entity. So what that means, and there are several specific subpoints to this, we should retain our statutory authority to provide oversight of the Children's Initiative Fund. So this work we do, the recommendation is this work remains as it's intended in the current statutory framework. But we currently have an MOU with the Department of Education. So wherever things get consolidated, get unified, let me use my own terminology. Wherever we unify these programs, if it's an existing state agency and we are simply moving programs from where they currently reside into one chosen place, we want the Children's Cabinet to live with that universe of early childhood programs and services. So whatever that means, it means the recommendation is the cabinet moves with these things. If it's something new that doesn't exist, we would move there too. So this is really making the point that our work and the work of the early childhood programs that are federally or otherwise funded, it belong together. We will have language in the final draft that preserves the duties of the Children's Cabinet. So as outlined in statute, we want that framework to stay the same, but we recognize that we need to be flexible and move where this universe of programs resides and be part of that overall entity. As part of that process, we need some delineation between the work this board oversees and the work, the administrative side of this new entity, this unified entity. So we will see language that speaks to this board continuing to retain oversight over grant programs so that we can continue to operate with the transparency and accountability that our process brings to that equation. So those are the major recommendations that I think are the most relevant to the work that you as a governing board are engaged in on a regular basis. There's a lot more to it. There is a very specific transition timeline so that, and the recommendation is to hire a transition manager, a specialist in the logistics of rearranging governmental programs. So it would be a third party. It's not going to be an existing agency secretary or director of some program that's already working for the state. This needs to be somebody coming in from the outside who can assess the logistics involved with shifting. You know, it may be the shift of a line item in a state budget, but the work that lives behind that is very complex. So there will be a recommendation to have a transition specialist in place by July 1 of 24 and to spend a year planning before anything starts moving. So this is the life course of whatever movement. Probably is not rapid cycle. It may be rapid in government years, but not in, you know, the human experience. We like, let's get this done now. It will be thoughtful, and that there will be a lot of necessary planning for the transition to be successful. And then finally, I mentioned metrics and data for how we measure success. Are we delivering a given type of service? You know, is the time to qualify someone to receive that intake process? Is it faster? Is it quicker to do a given function? Are we serving more families? Are outcomes improving for our children? Because obviously that is the heart of all of this. We want things to be better for our children and their families. So I'm pretty excited to see the public release of this and look forward to the work that lies ahead to try and get to an implementation plan. So we can move to the next slide. That leads us to the final portion of the report, the recommendations and conclusion. I want to remind you all that we gather up recommendations that this cabinet might adopt throughout the year. In years past, we've arrived at this meeting with a menu of recommendations already in place. This year, we because of all of that work on the task force, the futures thinking, we sort of adopted a status quo position with our June budget recommendation. We're obligated to move a budget recommendation in June so that the state budget life cycle needs are met. We convey the recommendation from this governing board has to go to the State Board of Education for adoption as part of the KSDE budget, given the current governance structure. So it means it bumps our budget decision-making into June because of the steps that then take place. But the budget isn't built yet. The governor will be sitting down. Today's December 1st. This month, she has time blocked with the Division of Budget to do her finishing touches on the budget the draft that they have put together for her based on all the agency input. So our recommendation as it stands is stable funding, just maintaining the level of funding that we had for FY24 into the FY25 budget. So I wanted to remind you all of that appears in the draft of the report that you have. Our design team is very adept and capable of adding additional sections. So we traditionally at this meeting take time to first and foremost answer your questions about the content of the draft that you received, entertain any input that any of you might have that we need to take into consideration to shape the final language of the report. The content is fair game, just like our minutes. We share this with you, and today you are invited to give feedback if you are questioning the way we've laid anything out or want to see anything added or whatever. So that discussion can happen. We would, if there's recommendations for changes, we will handle those as board votes. And then this is an opportunity to entertain any potential additional recommendations that you as our governing board might have to make. So I want to, Dawn, I'll turn it back to you to guide discussion among board members. We might want to start with any questions.
All right, let's do exactly that. Are there any questions on Melissa's presentation so far?
This is Leetta. I apologize. Unfortunately, I thought I had my phone muted. Thank you for the amazing presentation, all the work. And I just have to say, going back to Jessica's very first or second slide, the funding, where she called it the classic children's cabinet, the ongoing work. I remember a time when that number was much lower due to the Children's Initiative funds being swept into the general fund. So first of all, love seeing that number higher, and I'd like to reiterate that yes, I edify your recommendation to keep the funding stable there. And I wanted to ask about your recommendation that is in particular related to just the Children's Initiative Fund, because these other funding streams are just one-time funding allotments, right?
Yes. So unless, I mean, let's take the child care accelerator and the capital projects, that column in red on that slide. Those are, as they stand, those are one-time allocations to us. The source of those funds, it's all federal funding, with the exception, we do have the $2.5 million gift from the Patterson Family Foundation, but the rest of the money we braided together was pandemic relief funding. So that is there is no chance of those funds being renewed or reauthorized by Congress. That is it. So Those are one-time funds. Doesn't mean the program couldn't live on if there were enhanced funding provided. There could be another one-time gift. There could be a decision that, given the unmet demand, that it's okay to think about ways we might continue it, but there's nothing in the pipeline at the moment that would continue those funds.
Well, I'd like to point out that it was your creative out of the box thinking, Melissa, that made a lot of this funding work, because especially the construction, the money that went towards constructing actual facilities, you had to fight for that. So thank you again for that, because it's going to impact childcare capacity greatly. And I would think it might be worthy of wordsmithing something into our recommendations that, nod to the fact that we are aware that this ongoing need exists and would support additional funding being considered by the legislature to support this need.
I would welcome conversation among the board and consideration of that, Leetta. Thank you.
Thank you.
I'll just jump in and share my thoughts on that as well. It seems to me that stable funding was an appropriate recommendation back in June. Now that we have a better idea of the task force recommendations and what the future might look like, and most of what we know is that it's unknown at this point. It could take a number of different configurations. And so from that perspective, I think it's appropriate to adopt a recommendation that maintains some flexibility, allows staff to be nimble and take advantage of opportunities that we are not yet clear as the task force recommendations are implemented into actual policy. And another point I'd make that we discussed this briefly in the October meeting, the fact that for a number of programs funded with CIF, funding has been stable for a number of years. And that creates a very difficult challenge when you're in an inflationary environment, as we have been. So again, maintaining some flexibility in the recommendation, I think, is appropriate.
Yeah, I would agree. I mean, I can't agree more, to be honest. I think we need to start thinking about how we would wordsmith that.
No, this is Monica.
Yes, Monica.
So as a member of the task force, Melissa very, very clearly and accurately reflected the complexity of the conversations and of the process. We're kind of in a weird timing situation, but I'm so pleased that the conversation has happened over the course of the last year, and the recommendations are on a piece of paper, because we all know it has to start somewhere. And as we discussed in our October meeting when we were all together, we knew that the cabinet would play a key role in whatever the end product here is. And so as we were talking in that room at KASB the other day, that the nuts and bolts of that process will need to be worked out. But our board, it wants to send a message that, we are open and ready to be part of the solution of simplifying. And so I did work with Melissa on some specific words to put into a recommendation to make sure that the cabinet maintains its statutory obligations, but is still part of the game. So whenever it's appropriate for that, it's a pretty detailed recommendation with, lots of ifs, ands, and buts. Let me know when it's time for that. But, overall, I am really excited by the process, and I am hopeful that the legislature will take a serious look at the recommendations and take a serious look at how to move forward. A lot of time and effort went into this with a lot of different perspectives, and I think that's always time well spent. So that's my comment on that. So Dawn, I'll let you guide me there. And I just want to thank Jessica again. You make it look so easy with your beautiful graphics and your beautiful explanation of what is indeed hard work on the direct service end of this. The numbers are truly impressive, but also your team's ability to put those together in a way that's understandable. It's hard to ignore the impact for anyone who gives a dang about kids. So thanks to you and your team.
All right, well, thank you, Monica. Let's just go ahead and consider your follow-up on your discussion. Do you have a particular recommendation? Do you have something on paper?
I've got something on paper, and I'm going to read it out loud.
Okay.
Open to suggestions. It's long. Hang with me, friends. Okay, hang with me. We're way past the weeds. We're down into clay or stone based on wherever you live. Okay, the Kansas Children's Cabinet recommends the governor and the Kansas legislature work together to identify the appropriate method for unification of early childhood programs and services, and to create an implementation plan that recognizes the role of the Children's Cabinet in alignment with the Early Childhood Transition Task Force recommendations. That's the first part. We support exploring options to fully realize the Cabinet's statutory role as outlined in KSA 38-1901, retain the Children's Cabinet governing board oversight of the Children's Initiative Fund as outlined in KSA 38-2103, retain the role of the Children's Cabinet governing board as grant maker for any existing or new grant programs that may be developed and administered by the unified entity. Retain the role of the Children's Cabinet as the state's Early Childhood Advisory Council in accordance with the federal Head Start for School Readiness Act of 2007, Kansas Executive Order 20-02. Methods of collaboration and coordination between the Children's Cabinet Board and the unified entity's administrative leadership should be established. So with that recommendation, I would, if there was somebody ready to second that, I could explain more.
This is Lietta. I would second that.
All right, we do have a motion and second to consider the recommendation as given by Monica. Any discussion?
I'd like to explain a couple pieces of what I outlined.
Sure.
So you heard statutory language in there. So just as a quick, everybody knows what the heck we're talking about. The Cabinet statutory role is the 38-1901. So that's kind of like the foundation, the base of the work we do. Retain the Children's Cabinet governing board oversight of the funds. CIF funds has a different statutory number. So that's 2103. And then the role of the grant making, that is specific to the fact that we've created this really efficient and effective system of getting money in and out to the local level. Retain the role of the Cabinet's Early Childhood Advisory Council. Remember, that is required for the federal government with the Head Start piece in, and we are that body. So it includes that. And then finally, the message is just simply, we want to collaborate. So with that, I'll pause and see if anybody has any questions.
I'm gonna ask Lindsay, have you captured the crux of that?
I can send that to whoever.
Yeah, I think Lindsay's pretty good at tracking. So we'll give her time. There we go. Okay. So I think this is the language.
So this, as I mentioned, we're not in weeds, friends. We're way down there.
Yeah.
But this recommendation supports the infrastructure in the movement, but mostly it is a piece of moving forward with us having a say in it. Like these are kind of our basics.
It really, like, for you as a governing board, this really is planting a flag firmly around the work we do and saying, we're interested in supporting this overall move to try and streamline the early childhood system, but we have a role to play. Here it is. And so I would think for you as members of this board, this might be an important consideration.
I'm sorry to keep adding on. One other thing I think is clear in the conversations among the entire task force, with a quick reminder that the state agencies have a leadership role on that task force as well. In any new process, there will always be reflection upon statutory obligations, whether it's tied to a piece of funding or to something else. This group is really the only one. It's kind of one of these things is not like the other. When you look at KSDE, you look at KDADS, you look at DCF, and then Children's Cabinet, we aren't set up like that, right? That's not our framework. And so this is not intended by any means to say, oh, look at us, everybody needs to follow our rules. It's recognizing that the 4 big hunks of state government where early childhood programming lives, one of them is set up differently than the other.
Further comments?
Don, this is John Wilson. It'll be reflected in my vote, but I think this is a good idea. And I appreciate, Monica, you taking the time to craft it, and look forward to supporting it.
Just speaking as a former legislator, you're dealing with such broad subject matter in your job as legislator, you tend to forget the details. And I think what Monica has put together here is just a good reminder for legislators, anyone who influences the making of policy, that there is statutory authority. There's foundation in statute that created Children's Cabinet, and there is valid reasons why that should continue, regardless of what the future looks like.
And I would just point out that in the first meeting of the task force in March, the first order of business was to give each of the 4 key agencies, Cabinet, DCF, KDHE, KSDE, we each had 30 minutes to give a presentation. We had to fill out an inventory of all of the programs and services related to the birth to 5 universe. And agency leaders came in together and gave a presentation about the content of that inventory. And one of the details that we had to identify were any statutory obligations in place. So that is a framework in place. That spreadsheet exists. We've documented and inventoried the statutory role and responsibilities. So this speaks to where we are as a cabinet, and again, it indicates, what I see in this is flexibility to move into a new place, be part of a new vision for early childhood, but retain the heart of our work, which is governing governing the Children's Initiative Fund, managing those investments, and maintaining that role as sort of the strategist and all of those roles that we inhabit.
Further comments or input?
Yeah, this is Renee Erickson, and I so appreciate the work that went into this recommendation. I guess my concern is, as was stated, this is beyond the weeds. This is a substantial recommendation, and I don't know that I feel like I've had the opportunity to properly vet the implications or maybe have conversations about the impact of that. And I think specifically around, if I'm understanding correctly, the oversight of all future grants. To me, that's very broad, and I'm not sure I understand all the implications. So I'm just sitting here trying to process all of that because there's a lot packed into it. And so I guess that would be, I just want to voice that concern. I'm not necessarily saying I'm for or against it. I just don't know all of the implications of all of the detail that's in this recommendation.
I can appreciate that. I would say, in terms of specific wordsmithing, if there is a recommendation to get to something that feels more comfortable for you at this juncture, we are certainly willing to entertain it. These words are not carved in stone. I would say grants are different than administering a program. Like if you're talking about funding for childcare licensing, that is not going to come under the purview of this governing board. But if there is funding made available to give grants for a certain purpose, in my experience, as first as a lawmaker here in this role, running the cabinet, watching what goes on, the difference between setting up a grant program and administering a funded kind of program or service. I think this board is uniquely positioned with a process that allows for public input, transparency in how we go about taking applications. The review process is pretty straightforward and laid out in a way that there is a timeline up front that we adhere to. We are not a black box where you find out there's some incentive program somewhere and nobody knows when awards will be announced or how they're going about making decisions. We've got a really unique process for across the universe of state agencies. And I think that bullet point is just intended to elevate that role that we have as grant maker. And so it would be grant funding. It wouldn't be, the federal government has this particular fund, we're going to give it to the cabinet governing board. I think that's that final bullet that says there needs to be methods established in this planning process for the way the cabinet board functions and the administration of whatever this entity looks like. So we're just trying to speak to those. I mean, there's a lot there, but also I think the heart of this is just as a cabinet board taking a position on what we envision our role to be in this future that is in front of us.
And Renee, I think sorry, go ahead.
Well, this is John Wilson. I was just going to chime in and just share that I think for me, the kind of fail-safe phrase in this recommendation as proposed on the screen is we support exploring options too. So I don't think it is whatever, it's not guaranteeing. And I think it actually, it kind of mimics how the recommendations came out of that special committee on childcare and childcare homes, is where the committee, I think, Senator Erickson had maybe at that time had similar reservations as you did, where there's some aspects of it that they didn't fully understand, but knowing that they were just making a recommendation to explore or possibly considered, I think made it more comfortable for folks. So that's what gives me the comfort to fully to support this recommendation.
John, that's what I was going to say too. And I think too, I totally hear what you're saying, Renee. And I think for me, what I thought of when I saw this and, rolled it over, this was something we heard over and over during the task force process. As a local person, whether it's from, Wichita or Pittsburgh, that's trying to access state dollars in, that are supporting kids and families, it's a lot of work for them. And it takes away time. And so having been on that side of the fence and done that, I feel very comfortable that the children's cabinet process that has been built up over years really does streamline that. And so that's what I had going on in my head during this conversation. And that we want to just say, hey, we're pretty darn good at this, getting the money in, getting the money out, getting people paid. And so to me, that's what it was. But I would agree with John. This is pretty broad in that we are open to support and be part of this process. And here's a few things that we think we have to do and that we're good at doing. So.
Board members, any further discussion?
It's Renee again. I would just like to say I do appreciate the clarification of the intent behind this, and I do feel more comfortable. I still have a few questions, but I think knowing that it's framed in the way that John and Monica have explained, that was very helpful. So I appreciate that.
All right, this will be a roll call vote. So do we have a slide that I can use to walk through that process? There we go.
Don, I do not see Dr. Smith or Terry Rice currently, so.
Okay. There we go. How about that? That's good staff.
Man alive, isn't it?
John Wilson.
All right, first up, yes.
Monica Mernan.
Yes.
Elise Hofen.
Yes.
Deanne Owen Graham.
Yes.
Leetta Felter.
Yes.
Senator Renee Erickson.
Yes.
And Don Heineman votes yes. The motion is adopted. Thank you, Monica. So that brings us back to budget recommendation. I wonder what the board is feeling regarding the June recommendation. Is that adequate, or we want to flesh that out and make it a little broader, a little more flexible? Open for discussion.
So, I mean, I'm obviously grateful for any state funding that we receive and tobacco settlement funding that we receive. But I think, Don, to your point earlier, you mentioned, with inflation and other things, flat funding is essentially less funding. So I went off camera for a little bit to try to write down something, but I would like to make a recommendation that we look at enhanced state investment. And I have some language we can use if you want me to make a motion, and then we can have discussion.
Okay, please proceed.
Sure. So forgive me as I read here, my chicken scratch. In its role as strategist, that the cabinet recommends enhanced state investment in the early child care and education system to better meet the needs of young people and their families, reduce CIF transfers to other agencies, and maximize tobacco settlement dollars towards children's cabinet priorities as outlined in the Blueprint for Early Childhood and the All In for Kansas Kids strategic plan. And we can use acronyms where need be, or shorten words or whatever. But that's the recommendation, the motion.
All right, you have heard the motion. Do we have a second?
I'll second for discussion.
All right. John, we have something at least similar to your recommendation on the screen. You want to look that over?
Yeah, I am. I'm going to do that real quick.
Encapsulates it?
Yep. Yeah. Yep.
Okay, so
Yep.
we have a motion and second, open for discussion.
Mr. Chair, it's Renee Erickson again, and I do want to note that there was a similar recommendation regarding the transfer of CIF funds in the special interim on childcare and childcare homes. So I just want to make the board aware of that as well.
Yes,
Okay, very good.
Senator, I was pleased to see that. Thank you. And I would point out, John, I like the wordsmithing here. Enhanced state investment does not lock us into any one specific action, right? It's state investment can take many forms. So it might be supporting that reduction of the transfers out of the CIF to other agencies by replacing, like that might be state general fund. It could be part of the tax policy discussions that take place. So I really appreciate the flexibility built into this particular recommendation from the standpoint of our cabinet portfolio.
I was just gonna, this is John, I was just gonna quickly joke too, that if Senator Erickson, if this is the second place that recommendation shows up, maybe there's like a rule of 3 that if a third person brings it up elsewhere, it automatically becomes state law. like saying Beetlejuice 3 times.
All right, I don't know who can top that, but further discussion. Further discussion. Seeing and hearing none, we'll proceed to a vote. Again, it will be roll call vote. John Wilson?
Yes.
Monica Mernan?
Yes.
Delise Hofen?
Yes.
Deanne Owen Graham?
Yes.
Leetta Felter?
Yes.
Senator Renee Erickson?
I will pass.
And Cabinet Chair Don Heineman votes yes. The motion is carried. The motion is adopted. All right. Melissa has pointed out to me that there were recommendations in last year's report that we may want to revisit and consider whether they're still appropriate or if they have served their purpose. Melissa?
Thanks, Don. We have for several years running had a recommendation that speaks to helping families meet basic needs. Lindsay, can you put that slide up on screen? So in the 2022 report, it was language from the prior year. In fact, these three are the recommendations that I just wanted to bring to the table and see what the will of the board is with regard to all three of these. So Don, I think it's pretty self-explanatory. We can take them one at a time and determine whether or not we wish to revive a recommendation along these lines. The first is the basic needs recommendation that we've had the past 2 or 3 years. The second is a recommendation this board adopted last year that recommends an increase in state general fund dollars to draw down childcare subsidy, because there was additional room to do so in the federal program. I think that exists again this year. I would enter, if the board feels like the motion that we just adopted is sufficient, that would make sense to me too, or we can, entertain singling it out. And then the third one is a recommendation that just, again, it speaks to the mission of this body to use data and evidence-based research data to drive all of our decisions. That language is pretty straightforward. So, Don, I'll turn it back to you to manage the discussion around this.
Okay, let's pause here and give everyone time to read through and ponder, especially number one. Give that some thought, and then we'll open it for discussion when you're ready.
And just for the purpose of the live stream, I'll read it aloud. It says, increase access to work and family support programs that help children and families meet their basic needs. Research clearly shows that children thrive when their basic needs are met, and that parents and caregivers are better able to support children when their own basic needs are met. The Kansas Children's Cabinet believes current restrictions to childcare assistance, cash assistance, nutrition assistance, and health insurance programs undercut the investments made through the CIF and blunt the efficiency of early childhood care and education programs. The comprehensive statewide 2019 needs assessment and the 2020 and 2021 needs assessment update document these concerns. I would add that our intention had been to bring we're working on an updated needs assessment that got moved to our February meeting for reasons I'll go into, but it is taking shape and documenting. These concerns remain high need. So.
All right, thank you, Melissa. I think it's appropriate to consider each of these recommendations separately rather than as a block. So regarding recommendation 1, basic needs recommendation, we're open for discussion.
So this is John Wilson. I don't just to help with or follow the process. Can I make a motion to recommend the basic needs recommendation?
Yes.
Okay, I'm gonna do that, and then I have some thoughts.
I'll second,
Right.
Monica.
Okay, motion's been made and seconded. I'll turn it back to John for discussion.
Yeah, so I think this is still a relevant recommendation. I recall in Jessica's presentation, her comments about families struggling to meet basic needs and how that impacts their ability to be responsive to the needs of the children in their lives. And Jessica, you talked about something like, young parents of young children are young themselves and probably have some of the hardest time in their lifetimes at that moment. And so I think this is still relevant, and I continue to think about early childhood kind of like a recipe versus a menu. When you order something from a menu, you can pick one thing, but when you make a recipe, you need all or most of the ingredients for it to turn out. And so I think we've made considerable progress on the ingredient of childcare, especially as it relates to the cabinet's role in it. And so I think there are other areas though of children's lives that need support. And the programs that this recommendation references are generally, if not exclusively, federally funded programs that have federal requirements and restrictions, and then the state has in certain cases added additional restrictions to them. And I think those additional state barriers can make it difficult for families who are truly in need to access them. And most of these federally funded programs necessarily involve children. People can't access them unless they have children in the household. And so I think it's really important that we do all we can to make it easy and efficient for people to participate in these programs so that they can be better and more responsive caregivers at in these critical development years for their kids. And again, I want to highlight that I think most of these are largely federally funded with some state match for either administration or maintenance of effort or those sorts of things. I would maybe I should have made a slight tweak. There's that line of through the CAF and blunt the efficiency of early child care and education programs. I might actually say effectiveness or efficiency and effectiveness, but if it's too complicated to go back and amend my recommendation, I'll hold off on that. So those are my thoughts.
All right, further thoughts?
Fully support this. I don't think we can hear what we heard before and not throw it back in again this year.
What are your thoughts about inserting the word effectiveness into the recommendation?
Would agree.
Lindsay, can you get in there and it would be, did I hear blunt the efficiency and effectiveness of early? Yeah.
Yeah, the E effect, not the A effect one, right?
Thank you.
All right, further discussion? I want to do this in order and vote first on the amendment to John's original motion.
I think I see Senator Erickson coming off mute. Sorry.
Yeah, and I
you.
can wait, Mr. Chair. It's not about John's. It's a broader question about the overall recommendation. So I can wait until we take care of John's.
Okay, thank you, Renee. Let's proceed to a vote. Let's do it by roll call vote again.
So
we have
to clarify what this vote is.
This vote is on the amendment to add the word effectiveness.
Can we, if I don't know, forgive me for not knowing the proper procedure, but I would like to amend my motion to reflect the currently written recommendation that added effectiveness to the statement.
I think procedurally, if the seconder agrees to that is all that's necessary because nothing else was adopted.
The seconder does indeed agree.
Okay.
Well, that makes it simpler.
Yeah, so I think we can address any additional discussion before moving to a vote on the motion on the table.
All right, so we're back on discussion on the recommendation as amended.
Yeah, Mr. Chair, Renee Erickson, and could Melissa or somebody, the current restrictions that are mentioned in the recommendation, can you kind of give us an update at maybe what some of those are? Has there been some headway, and kind of delineate what the state restrictions might be, just so I have a better grasp on those?
Yeah, I mean, I can validate that we have made progress with childcare assistance in particular. Credit to DCF for addressing the rate of the subsidy that is provided and the qualifying income levels. We have additional work to do. And so that in particular, I think, this is just language that in that case would say the cabinet is supportive of those efforts. John, I think you probably have a better handle on some of these other topics than I, because they begin to broaden beyond the early childhood programs that we run at the cabinet.
Yeah, and unfortunately I don't have like pulled up. This is John Wilson, Kansas Center for Children. Don't have a side by side pulled up, but a couple stand out to me when I think about the cash assistance program in Kansas. That cash assistance is just a basic cash payment to very low income families. The federal government allows up to 5 years of eligibility of lifetime eligibility for cash assistance. I believe Kansas now has a 24-month lifetime limit for cash assistance. And so you go through a couple of years of the pandemic and you are no longer eligible for cash assistance. So that is one example. We have various, there have been discussion last session and likely will continue into this session, discussions around child support cooperation enforcement requirements to receive child care assistance, which can disproportionately impact women and from even deciding to apply for programs because of concerns for their safety and those sorts of things. And then health insurance programs. I mean, I think more broadly, we do know that, as an example, when states that have expanded their Medicaid program have seen an increase in enrollment in children in health insurance programs, because when parents are covered, or when adults are covered in their lives, they're more likely to make sure children also are covered and receive the doctor's visits necessary. So that obviously that Medicaid example is not an example of a restriction necessarily, but it's an example of a policy choice that hasn't been made. So this is the recommendation doesn't spell out all the specific barriers, and I think it leaves it fairly broad with the idea that we want to increase access to work and family support programs. And so one way to do that would be eliminating barriers that are statutory. Another way might be improving the efficiency of the programs and how they're administered through applications, because we've had very long combined applications to receive programs like that. So that's the intent of this, of my thinking behind the recommendation.
Dawn, Monica, Dawn or John, anybody. For me, when I think of this, I think of back to what was presented to us previously, and we talk about mental health supports around families with very young children. Currently, we have some things in play in the state that limit who can be paid for those services, what types of providers. I feel firmly that we're at an all hands on deck kind of situation right now in the state as it relates to families with very young children and behavioral health services, whatever that may look like for that family. And so to me, that kind of fits into here also, because we just have some rules in place regarding, who can do it, how often they can do it, that kind of thing, that could be looked at for expansion to support families.
I guess I would weigh in. This is Melissa. I would just say this is not a prescriptive recommendation to do some certain something. But it is the cabinet interpreting all of the data that we gather and report on and making a recommendation to center the understanding we have about the difficulty families are having in decision making as decisions and opportunities come up. So I would just point to when I read this, the intent is just to remind that we know from our work that these are the struggles that families are having.
Yeah, and it's Renee again. And who's going to disagree with wanting to remove restrictions and helping families access what they need? But as we flesh this out, and I heard John say, pointing to Medicaid expansion, and I totally agree with Monica on limiting the number of providers, but those are the types of specific details that give me pause, because I do not support Medicaid expansion. And so that's where I'm trying to figure out, of course, I want to remove barriers. It's agreeing on what those barriers are in the best way forward that I'm kind of hesitant on, if that makes any sense.
Absolutely, fair that you bring a different perspective to the table. And we're here to discuss all of you. You all have an opinion to offer here. I think about other types of health insurance situations. John, did I see you wanting to weigh in?
Yeah, if that's okay, just real quick, and I think Monica also wanted to say something. And Senator Erickson, I appreciate your perspective, and I realize as soon as I said the words Medicaid that I am stepping on a third rail in Kansas policy discussions. I would say that if I would feel comfortable making a Medicaid expansion specific recommendation if I thought this was the appropriate place and time and all of that. And so my mentioning of it in the recommendation specifically for basic needs was really looking at the state imposed barriers to existing federal programs. And as a reminder generally that children need more than one thing, and that I want to make sure that anybody reading these recommendations understand that if we make significant progress on childcare assistance but lag on other areas, then we haven't totally supported the health and well-being of kids. In the same way that if we made huge strides on increasing access to the SNAP nutrition program but didn't do anything on childcare, we wouldn't be making any the right steps. So I do want to say that I can understand your perspective on the Medicaid expansion issue specifically. I think it is a good idea, but for this specifically, that's not my intent to make sure that the cabinet is on record for that.
No, that right. And I would say some of it is billing code related. Can we bill for services in different areas? That is a health insurance program restriction that undercuts the investments we're making. So I don't read this either as an explicit statement of the cabinet taking a position on Medicaid expansion. I do read this in a broader sense that as we are addressing different policy decisions, remembering the impact, getting back to that future fellow conversation we just had, thinking about the ripple effect of those decisions. That's how I interpret this. So I just wanted to put that in the record for you all to think through.
I'm going to propose a suggestion, a change that might possibly soften the recommendation just slightly. My recommendation would be to replace the words current restrictions with the word impediments. Children's Cabinet believes impediments to childcare assistance, etc. Does that make a difference to you, Renee?
Sorry, I am literally in the Phoenix airport waiting to
Oh,
fly,
gosh.
so I'm sorry if I'm a little
Shoot.
distracted too. Impediments. Yeah, and I don't disagree. I want to be clear. I don't disagree. We need to remove impediments or restrictions on families getting what they need. It's the details that I'm just wanting to flesh out.
Yeah.
So, yeah.
And Dawn, this is Monica. I honestly don't want to soften it. I mean, they are restrictions. They are restrictions that have to have action to remove. And so I don't think, the intent of this isn't about Medicaid expansion. The intent is we just need to use our noggins here. And if there is something that we can remove a restriction to make that path go forward for that family, that we will at least look at it. That's what I'm here to, I mean, that's what I'm thinking this says. And I totally agree on the details, but at this point, this is just simply a recommendation from us as a group that we're saying, hey, please take a look.
Fair enough. Further discussion? If not, we will proceed to a roll call vote. John Wilson,
Yes.
Monica Mernan,
Yes.
Delise Hofen,
Yes.
Deanne Owen Graham,
Yes.
Leetta Felter,
Yes.
Senator Renee Erickson,
No.
and Cabinet Chair Don Heineman, yes. The motion is adopted and that recommendation will be included. Let's proceed next to the second holdover recommendation from a year ago.
It's Monica. I move to approve the recommendation entitled Childcare Subsidy Recommendation.
Do I hear a second?
This is Leetta, second.
All right, motions have been made and seconded to again make recommendation regarding child care subsidy. Open for discussion. Any discussion?
This is John. At the risk of talking too much, but hey, that's what we're here for, right? We discussed this a little bit in the 2 interim committees on childcare this fall. But if it weren't for tobacco settlement dollars and people smoking and federal funds coming to us to Kansas and a little bit of money in the 3- and 4-year-old program for the school finance formula, like we wouldn't be spending a whole lot of money as a state, investing a whole lot of money as a state into childcare. And so as long we need to continue drawing down these federal funds. It is so critical to the health and safety of childcare and the quality of childcare and the profession as a whole. So
further discussion. Any more discussion? If not, we'll move to a roll call vote. There we go. John Wilson?
yes.
I'm sorry to interrupt. I apologize, but I just want to note that Dr. Smith just joined the meeting. So handle that how you will, but apologies for interrupting.
Okay. All right.
That was a yes in case you didn't get mine.
All right. Monica Mernan,
Yes.
Delise Hofen,
Yes.
Deanne Owen Graham,
Yes.
Leetta Felter,
Yes.
Senator Renee Erickson.
No.
All right. And the member who just joined.
Good morning. I'll abstain.
Okay, thank you. Thank you, Dr. Smith. And Cabinet Chair Don Heineman votes yes. The motion is adopted and that recommendation will be carried forward. Moving on to the third recommendation from a year ago. Data-driven decision-making recommendation. Do I hear a motion?
Monica Murnian, I'll move to approve as stated.
Do I hear a second?
This is John Wilson. Yes, second.
All right, thank you. We do have a motion and seconded. We are open for discussion on the recommendation regarding data-driven decision-making.
This is John Wilson. I think one of the reasons I feel really comfortable re-upping this recommendation is that between the needs assessments that have been done, the rigorous evaluation of the ECBG programs, data from sources like Kids Count, all of the All-In for Kansas Kids strategic plan, all the various ripple effect things that we're learning. We have plenty of data at our fingertips to inform decision making. And I think what's nice about this recommendation is it can be applied to kind of all aspects of child development and well-being. So health and childcare and early learning and economic security and all of those things, hunger, all of it. So that's why I feel comfortable supporting it.
Further discussion?
Good morning. I also agree with this recommendation, as a lot of times when people are looking at what are the reasons behind why we're doing what we're doing, it's very helpful, especially if you have the data and the information. Working in a space in healthcare where people are always asking, okay, well, what's the standard of care? What are you using to determine that? It's not just based on whim, but it's based on data driven. And also the fact that when you look at kind of your N or your number of people that you're looking at, when you can show that you have a large number of people that have been assessed and evaluated to come up with these recommendations, it's also very helpful for not only stakeholders, but for other people who are better trying to understand how those decisions were made. So I'm definitely 100% for this.
All right, thank you for that perspective, Dr. Smith. Further discussion? Further discussion? Seeing none, we'll move to a roll call vote. John Wilson?
Yes.
Dr. Tyler Smith?
Yes.
Monica Murnian?
Yes.
Delise Hofen?
Yes.
Deanne Owen Graham?
Yes.
Leetta Felter?
Yes.
Senator Renee Erickson?
Yes.
And Chair Don Heineman? Yes. The motion is adopted. All right, Melissa, is there anything further that we need to consider regarding recommendations to go into the report?
I appreciate the work done so far. The three we just did were the loose ends I was curious about from last year's report and a continuation of our work. I would put that question back to the board, whether there is anyone else with a recommendation to bring forward. Now would be a great time to let us know that.
This is Leetta. You know my perennial recommendation about suing vaping, Juul and vaping companies. I don't know how y'all feel about that. I can speak a little bit more about that, but the Master Tobacco Settlement Fund is our primary, sorry, I didn't know my video was off. It's our primary CIF funding source, and vaping, has impacted that. It's owned by Big Tobacco, and since 2017, I've been trying to get the state of Kansas to sue Juul and vaping companies, and it hasn't happened. But I was successful in getting Olathe Public Schools to sue, and we prevailed and won that lawsuit. So it's a worthy endeavor.
But I would just say that we did explore the options, and that like we're in a different position than your school district was, and we do have the presentation next up on our agenda is on the topic of the tobacco settlement with one of the assistant attorney generals. So we can, maybe we would be better served listening to the presentation and then circling back to discussion about the recommendation that you have, and we can come to some understanding of the will of the board at that point. Would that help?
Yeah, that sounds great.
All right. So aside from Leetta, again, just wondering if any other board members have thoughts for things to include in the report. Any last adjustments, because the last action we'll take today and we'll hold until we've been able to discuss Leetta's recommendation more fully, but we will take a vote to adopt the annual report as amended today at some point in the meeting. So now is the opportunity. Hearing none, Dawn, maybe now would be a good time. We appreciate Jordan's patience, but do we want to move to the next item and return back to the annual report?
Yeah, I think that's appropriate. Let's delay final adoption of the report, and we'll hear from Jordan Brewer next on the master tobacco settlement. Jordan is Assistant Attorney General and works with the Tobacco Enforcement Unit. Jordan, welcome to the committee, to the board.
Thank you, Chairman and board members and staff. I appreciate the opportunity to speak on this subject today. Can you hear me okay, first of all?
Yes.
Okay, perfect. Wonderful. As you said, my name is Jordan Brewer. I'm an Assistant Attorney General and Director of Tobacco Enforcement Unit for the Kansas Attorney General's Office, and I've been in this role since 2013. So I'm quite familiar with the Master Settlement Agreement, with everything we've done since then. I've been the primary contact for the state regarding these issues now for 10 years. And I was interested in this opportunity when Melissa brought up the chance to speak to you about this, that a subject that maybe goes overlooked quite a bit. I know when I tell people what I do, they have no clue, and you may not have any idea, and probably just take the payments every year and just assume that that's how it works, but it's not. I wanted to kind of go into detail about a lot of behind the scenes, what we do, the background of the MSA briefly, what's happened since the MSA, and what the future holds regarding MSA issues and potentially vaping as well. I'm not going to go into technical details about the agreement. It's quite complex, and most of it probably isn't relevant to any of what we're talking about today, but some of it might be, and I'd be happy to take questions at the end. So a brief background: back in the mid-90s, a lot of the states started filing lawsuits against the large tobacco companies for various claims related to health effects of cigarettes and youth advertising and youth becoming addicted to their product. And so after a majority of the states started filing those suits, they all got together with the big tobacco companies and entered into this large agreement called the Master Settlement Agreement. In total, 52 states and territories, and including DC, signed the agreement with the big tobacco companies. 4 states are not part of the MSA. Those are Florida, Minnesota, Mississippi, and Texas. They have separate agreements with those companies that were entered into before the Master Settlement Agreement. So every state has some sort of an agreement, but the overall Master Settlement Agreement that Kansas is part of is the big one with the majority of the states. One of the bigger issues back in the mid-90s was the increase of youth smoking cigarettes, and studies showed that in 1997, over 36% of high school students were smoking cigarettes. So it obviously was a major issue, and one that the Master Settlement Agreement set out to attack. And one of the big things that came out of the agreement were restrictions on advertising, particularly prohibition targeting youth, limitations on tobacco brand name sponsorships through sporting events. People probably remember the Winston Cup for NASCAR. A lot of those restrictions apply to those types of sponsorships now. The ban on tobacco brand name merchandise, prohibition on cartoons like Joe Camel, elimination of outdoor and use of transit advertising, ban on youth access to free samples, and prohibition on material misrepresentations of fact, which was a major issue underlying the cover-up of the health impact of smoking cigarettes. And out of all that, out of all the restrictions and out of the Master Settlement Agreement came essentially two types of cigarettes: the participating manufacturers and the non-participating manufacturers. Those participating manufacturers are the big boys that everybody's aware of: Reynolds with Camel and Newport, Philip Morris with Marlboro and their large brands. Those are the companies that entered into the settlement with the states. And since then, there are some other companies that have joined that fit into that same threshold. And those are the companies that also make the big payment to the state every year. And then on the other side, you've got your non-participating manufacturers. And those companies aren't bound by the terms of the Master Settlement Agreement, but still face restrictions on sales in the state through statute. Those companies are, for lack of a better term, lower tier cigarettes, ones that you probably only see at discount smoke shops. They're not nearly as popular as the big brands. They typically cost a little bit less. They have a substantial market for their base, but aren't considered large manufacturers. Now, while they're not subject to the terms of the MSA, federal law has finally caught up to a lot of those advertising restrictions that apply across the board. So while they may not face those advertising restrictions from our settlement, there are federal laws that do apply to them as well. And it is worth noting that the Master Settlement Agreement only covers cigarettes as defined in that agreement, which includes, of course, your traditional cigarette, and then a variety of tobacco called Roll Your Own, which is typically sold in pouches and can be inserted into tubes to make a cigarette. It does not cover pipe tobacco, cigars, or what's obviously relevant nowadays, electronic cigarettes. So those are not covered by the Master Settlement Agreement. There are some types of smokeless tobacco that are covered by a separate agreement, but we don't receive payment for those. The restrictions do go forward. The other big thing that came out of the Master Settlement Agreement, and what my primary responsibility is, are these MSA escrow statutes that apply to the sale of cigarettes across the board in the state of Kansas. So turning to what's happened since the Master Settlement Agreement, most states have a unit like mine, a tobacco enforcement unit. It's typically centered in the Attorney General's office, or some states through the Department of Revenue. Either way, our office works heavily with Department of Revenue. Well, their primary focus isn't on Master Settlement Agreement issues. They do handle a lot of those as well. My unit is a three-person team. Myself, the sole attorney. I have one law enforcement officer who's an agent, and a auditor who looks at a lot of the reports. And our obligations are to enforce the terms of the settlement and the statutes, and we do that by a variety of tactics, one of which being we require certifications from manufacturers. If they want to sell a cigarette in the state of Kansas, they need to submit documents to my office for review, and they have to comply with a variety of federal and state laws and assure that they will do so. We also publish directories, tobacco directories on our website that are available to retailers and wholesalers, so that they can see what cigarettes are actually legal to sell in the state and what aren't legal. That way we don't have an influx of illegal cigarette brands that start coming into the state that we don't have any tracking authority over. We do track all the cigarettes sold in the state. This is where Department of Revenue comes in, their primary responsibility, through stamps that are placed on the bottom of packs, and through monthly reports that wholesalers are required to submit. So we have a good idea about what's being sold and where it's being sold. And that's particularly important to our regulation on non-participating manufacturers, the companies that didn't sign the agreement, because while they don't pay money to the state, they're required to pay a certain amount of money into an escrow account that is held there for 25 years. And so if we ever have to file suit against them for any claim related to one like under the master settlement agreement, there's a pile of money that we can collect for those sales that have occurred. And so that money's sitting there in escrow currently. We also conduct inspections on retail locations and wholesale locations throughout the state, and we'll file lawsuits and defend lawsuits related to tobacco issues. Turning to the payments, which is obviously what's most relevant to the funding that the cabinet receives. Those payments continue to come in. I know there were some statements that came out early on that the payments would maybe end after 25 years. That's not the case. The payments will continue on in perpetuity as long as cigarettes are being sold. So we are at our 25th year now and continuing to receive healthy payments. Our most recent one in 2023 was around 56 million, which brings the total we've received under the Master Settlement Agreement to over 1.4 billion. So that's been quite a bit of money that's come in over the years for use, and as I think has been noted a couple times on this call, that use is set by statute to go to the Kansas Endowment for Youth Fund. That statute's 382101, and that has controlled what happens with those payments since 1999. Payments are not guaranteed though, and that's where the role of my office and the Department of Revenue comes in. It's a settlement agreement, works both ways. Manufacturers have obligations to us, but the state has obligations to enforce the terms of the settlement as well. That obligation is called diligent enforcement, which has been an interesting concept over the years because it's not defined, it's subject to interpretation, and it continues to change over the years, and has led to several disputes that have jeopardized some and potentially all of our payments for various years. The biggest one being the non-participating manufacturer adjustment. We were brought into arbitration over year 2003 sales that happened that year, and it did put a lot of money we received in the past into jeopardy. We did settle it along with the majority of those states. We settled those dispute issues from 2003 through 2022. So that settlement has ended, and we're kind of back to square one on that at the moment. But that protected any potential liability for payments we had received during those years. And just so you know how technical and lengthy those disputes can be, states that didn't settle are still disputing years 2005 through 2007 right now. We're in 2023, and they're still hashing out issues that happened that long ago. The impact the Master Settlement Agreement has had on youth tobacco use, I don't think it can be discounted. As I said, in 1997, over a third of high school students reported smoking. In 2019, that was down to 6%. I think a lot of that is due to what we've done under the Master Settlement Agreement. Unfortunately, a lot of that can be also due to the rise in vaping, which didn't exist at the time. In 2022, the reports were that 14% of high school students were vaping. So that might unfortunately be part of the reason. But the Master Settlement Agreement has still been quite successful and will continue to be so in the future regarding sales to minors and overall smoking rates. What the future holds, we'll continue to do our work. It doesn't end. We'll handle disputes. I'm sure there will be new disputes that I can't even anticipate that will come up in the future. There will be legislation. We've changed our statutes a little bit over the course of the years, just to adjust to new issues and settlements that we've had with the companies. We've had our travel compacts as well, which help regulate a lot of the sales on those lands within the state. And like I said, we're going to continue to get payments. Unfortunately, those payments, as I'm sure you've probably seen, they are going down. But that's a function of the Master Settlement Agreement being successful. There are less cigarettes being sold, and that impacts the amount of money we get every year. And outside of the MSA, electronic cigarettes are obviously a big topic right now. I know somebody mentioned Juul earlier. We actually did, as a state, or enter into a settlement with Juul, a multi-state settlement back last year. In fact, it was a consumer protection-based issue. it imposed a lot of restrictions on Juul, and we did get payments. I believe there was somewhere around $10 million that are going to come to the state over the next several years. The use of that would be set forth under the settlement. The biggest problem we have with the electronic cigarette world right now is it's kind of the wild, wild west still, unfortunately, where we've known who the big cigarette manufacturers are for a long time. The electronic cigarette manufacturers are quite numerous. There are a lot of different brands that pop up on a daily basis, disappear, rebrand. It's hard to track everything that's going on. And part of the reason for that has been the federal government's slow work in addressing that. However, they have now, the FDA now is starting to regulate these products the same way they've regulated cigarettes for years. And it's starting to narrow down that pool and identify who's selling legally and who's selling not according to federal law, which will help us to potentially advance anything against those companies in the future. And the federal government, obviously, in addition to cracking down on those, is cracking down on flavors with a variety of flavor bans, and including potentially menthol as well. So a lot to be determined still on the electronic cigarette landscape, but I think we're starting to figure it out a little bit better on at least the federal level, and hopefully we will on the state level as well. So that's kind of my brief overview of what we do, how the Master Settlement Agreement is operated, and I'd be happy to take questions at this time.
Mr. Chair, it's Monica. Hey, thanks so much for this. This was really helpful, textual, and thanks for working on the back end so that we can be doing this work on the front end. I was around 25 years ago when we said this will last for 25 years. So man alive, what is a good day. I think we should shut the meeting down saying there's still money. So thanks for the work you do.
Sure.
Questions from Jordan?
Yeah, this is John Wilson. Jordan, thank you for the presentation and the daily work that you and your team do on this issue. I was curious about the roughly $10 million settlement with Juul. I don't know if you mentioned if those funds have to be used for something specifically. My understanding is they are deposited to the state over the next 6 to 10 years, right? Like, has there been a stated kind of purpose for those funds?
No, the settlement left that up to the interpretation of the legislature. They go into the general fund, and I guess anything that happens after that is outside of what I have any knowledge of. But yeah, there isn't anything actually specified in the settlement what will happen to those funds. Now, you might see if you pull up other states, that one was up to the interpretation of the states. So there are a variety of different clauses depending on what state you're in. So some states might have used it for designated purposes, but a majority of them, including Kansas, didn't actually specify. Okay.
And then one other question is, I was on the tip of my tongue and I just lost it. So if I'm not an attorney, but if we settled with Juul on their marketing practices, does that prevent any future suit by the state related to the type of thing like that would be similar to how we sued Big Tobacco 25 years ago? Does that make sense?
I don't think any other governmental agency could bind the state as a whole. I think it is, I guess, possible and subject to interpretation of law whether or not the AG's office settling on behalf of the state applies to other governmental agencies or organizations. I'm not the expert on that. I can't really speak to it, but I don't think any individual board or school district would necessarily impact our ability or anybody else's ability to file a suit in the future.
Gotcha. Thanks.
Jordan, I'm curious about the timing of the payments under the settlement agreement. When will those begin?
The Juul agreement?
Mm-hmm.
We received the first, they are due by the end of the year, each year. We received the first payment last year, so December of 2022. I don't know if we have received the 2023 payment yet, but it will be due by the end of this month.
So is there direction in place for how those funds will be used, or so where are they currently residing? Like what is their fate currently?
I think, and I wasn't a part of these conversations, but I believe they did have a plan for what they did with the 2022 payment. The legislature, there was some sort of committee that designated what happened with those funds, but I am not sure if they have done that with what will happen in future funds. And I really wish I had more information on it. I could try to figure that out, but I do believe that there were discussions on previous funds and future funds, but I'm not sure how that ended.
Thank you.
Jordan, I have two questions. I'll just toss them both to you.
Mm-hmm.
I'm wondering about tobacco sales on the reservations, whether that is part of the master settlement, and do you track and monitor those? Second question regards the tax avoidance scheme, which I understand happens from time to time. Cigarettes are bought in bulk in Missouri, brought into Kansas as a way to avoid the higher tax on cigarettes in Kansas. Do you track that, or are you aware of that? Do you have any information on that?
Yeah, I'll start with the first one first regarding the reservation sales. That is a legal argument that I probably don't want to put on the record for this state or any other state. There are states that will argue that those sales don't apply. When we settled the NPM adjustment, we went ahead and acknowledged that we are tracking those sales under our statute, and that's why we entered into tribal compacts with all four of the reservations that are located within the state. So we do track those under those compacts for master settlement agreement and statute purposes. There are some restrictions on those that are under the compact, and we get reports on brand sales similar to what we do from other wholesalers throughout the state. So I'm not going to speak on that position to any other state because I don't want to jeopardize any argument they may have in the opposite. But our position has been that we will track those sales, and we are doing so. Regarding illegal cigarette sales, Missouri has the lowest cigarette tax in the country, still at 17 cents a pack. It's significantly less than any of the surrounding states, and obviously we have a large bordering community with that state, and the chance that illegal cigarettes flow into the state, it happens. We do track it. We do have inspectors that go out. If we find cigarettes on the shelves at locations that don't have a Kansas stamp, we do seize those and file. The retailers fined, depending on how the severity of the issue, and we may go further with that. But it is something we do track, we do inspect for, and we do seize as contraband whenever it's found. But it is obviously an issue. It's a bigger issue for some of the other states that have a bigger gap in cigarette tax. Illinois, especially into the Chicago area, has a much bigger issue with illegal cigarettes coming in than we do. But it is something we see on a regular basis, and we are doing everything we can to stop it.
This is Leetta. Thank you, Jordan, for the presentation. It's great to know that there's been action with Juul. I would be very interested in knowing the terms of the settlement. Back when Derek Schmidt was Attorney General, and I had made my trip to Topeka to ask him to sue on behalf of the Children's Cabinet, because from my perspective, it was a work around the Master Tobacco Settlement Fund in a way, and eroding the revenue received by the Children's Cabinet. So if there's a way to know the terms of the settlement, and then a way to influence the direction of the settlement towards the original intended purpose, which would be the Children's Initiative Fund, if it was a combustible cigarette that was delivering the tobacco or nicotine, I would greatly support that.
Yeah, as far as the document itself, I believe it is public record. It is out there somewhere. I can find it and send a link to Melissa, and she can distribute that to everybody so that they can review. But yeah, that the document itself is public. Every state's document should be public. And as regarding what happens with the funds going forward, unfortunately, because of the terms, it's I believe it all comes down to the legislature and whatever committee ends up being responsible for that. I don't think there's any position at this point that our office can take on it, just given the way it's structured and what happens with the payments.
Leetta, we'll do some due diligence to inform this board of what the current status is of the use of those funds. And certainly, Jordan, as soon as you send me that link, I will share that with everyone who, so that it's available. We can post it with our meeting notes online too.
I think that would be great. I'd appreciate it, Melissa. And I mean, I think we have a long track history of documenting the fact that we've been beseeching the state to take action, and the fact that action was taken. I don't think it would be out of line for us as a governing body, you know, when we revisit our recommendations, to embed something general, you know, stating that our recommendation would be based on what, you know, whatever we hear, you know, is and incorporated in the settlement terms, you know, that we would encourage those funds to be directed towards the children of Kansas. So whenever it's appropriate for that discussion, I'm happy to have it.
Great, thank you. Other board questions for Jordan?
All right, seeing none. Jordan, thank you for being with us this morning, and thank you for your patience. It took us a while to get to you, so we appreciate you being with us, and thank you for the information you had to share with us.
Yeah, no problem. You're very welcome. Everybody take care. Thank you.
Thank you. All right. I think at this point it's appropriate to consider an additional recommendation. It does appear that there has been some movement, some agreement regarding the broad topic of vaping. So, Leetta?
I was just sitting here trying to jot down. If you could hear the noise in my house, you would know why I'm kind of fragmented. I home office, so and we're in the middle of a remodel. So if anybody has any wordsmithing, but in light of the Juul settlement with the state of Kansas, I would move that the Children's Cabinet encouraged the legislature to consider directing settlement funds from that Juul settlement towards the Children's Initiative Fund. We can wordsmith that much better. Please help me, guys.
It's Monica. I'd second that for discussion.
All right, the motion has been made and seconded. Discussion.
Again,
pretty much at it. It doesn't need to be complicated, I don't think.
Okay. I'm just saying, historically, I mean, before vaping, the delivery of nicotine was through combustible cigarettes, which were captured, the revenue was captured and directed towards the Children's Initiative Fund. To me, it's a very cut and dry argument. And in a very gray world, my world is very gray. This is a very black and white argument and very simple to me. And it's doing right by the children of Kansas. I think the legislature in '97 was very clear about their intent for the Master Tobacco Settlement Fund. And, you know, I don't think it's like an overreach or an over ask. And we have every year embedded in our recommendation in recent years that we encourage the legislature or the state to consider suing the vaping companies. So yeah, I think it's a simple recommendation.
Yeah, Lindsay once again excelled and has the sentence on screen. Would you, is that your motion as stated as you would desire it to be?
Beautiful, Lindsay. Even better than I said it. Thank you.
Yeah, this is John. I also support this recommendation and recognize that, $10 million over the next handful of years isn't an incredible amount of money. But when I think about the needs of direct service providers, when I think about the number of people who are excluded from inclusion in the ECBG portfolio because of our relatively flat funding, every little bit being directed towards this could be helpful. And what better place than a rigorously evaluated and highly effective grant program?
I think once I receive the link from Jordan, I think it might be prudent for us to direct staff to add that. We have the latitude when we are putting the designed document together, so we could put some context. We can make clear this sentence is the recommendation, but it relates to the settlement that can be found at this web address, so that there is some context around it. I would just ask for the board's approval to have that permission to.
What are your thoughts? You okay with including that?
I am.
All right. Seeing no dissent, I take that as board approval. I would suggest the issue is broader than just Juul. It's e-cigarettes in general. So maybe we need a preamble that points out that the transition from smoking tobacco to smokeless tobacco represents a negative effect on the master settlement funds. And the board supports any activity, any efforts to apply a similar master settlement or other legal settlement to smokeless tobacco in general, rather than just Juul in particular.
I support that. And we may want to tweak, Don, that's an astute catch, because it's going to be more than Juul. It's going to be Juul and other vaping companies. I wish I had my Olathe Schools documents right here, but there's specific verbiage on the settlement that will appear. So maybe you could just put vaping settlement funds, be more generic.
Yeah, I'm good with that.
And I can't remember, this is John, I can't remember if this is what you just said, but if we do kind of current and future settlements too.
Yeah.
I like the current and future.
Mm-hmm.
Leanna, I'm not an expert on this at all. You're saying the phrase a couple times, non-combustible.
Yes. Mm-hmm.
Is that important here? Because Dawn said smokeless, but I'm not an expert on the topic. I think those are two different things, aren't they?
The Master Tobacco Settlement Fund is based on combustible. So you light up a cigarette, and that's what Jordan was kind of saying. And it's a certain type of cigarette. So like pipes, they're combustible, but they're not included. So, when I'm just talking about the settlement and how vaping has impacted it, it's because it's a different delivery mechanism is essentially it.
Got it.
That's a better term. Smokeless tobacco raises confusion regarding snuff and chewing tobacco and places we're not wanting to go right now.
That's right. And if I could just say that had we sued much earlier, this is paltry. Paltry settlement compared to what we could have had. It's a shame. I'm glad we've got it, but
Only people had listened to you, Leanna. Put it on their record.
it's very rare, right? That they do.
I want to make sure that we're capturing the right language, and so we've got on screen, this is the actual motion. Direct. Did I hear that we want to remove the word? Okay. There you go. Lindsay was ahead of me. Thank you, Lindsay. And then she's sent me the notes as she was trying to transcribe that conversation, capturing the essence of Dawn's language is that the transition from we'll use the term combustible products to non-combustible, right? That's the essence of that, represents a negative impact on the Tobacco Master Settlement Agreement. Like,
Yes.
just to get the heart of what the contextual paragraph in the report will include.
And this is John Wilson. I might, in the event that Kansas changes laws to allow vaping of other types of substances, we might say future tobacco vaping settlement funds. Or not.
Yeah, to be specific, yeah.
So do we have on screen, the motion would be this recommendation. I think that let's take that as an action that needs to be considered.
Leanna, as the maker of the motion, are you good?
I'm good. Do we want to add the word tobacco between future and vaping, as John suggested?
So would it say current and future tobacco and vaping?
Tobacco vaping. That's what the whole settlement hinges on, is big tobacco that we are vaping. You can also vape other things. So this settlement is with tobacco products. So that's perfect. Yeah.
We have a question from Dr. Smith.
Yes, that was my question, because of just thinking about that. Teens and young people are vaping things other than tobacco. So does it just need to be tobacco vaping? Just wanting to make sure that I'm clear in that understanding.
In my opinion, yes, because that's what the lawsuit is settled with.
Yeah.
Anything else, we can address in future time.
Thank you for the clarity.
Yeah, thank you for asking.
Further discussion? All right, seeing none, we'll proceed to a roll call vote. John Wilson.
Yes.
Dr. Tyler Smith.
Yes.
Monica Mernan.
Yes.
Delise Hofen.
Yes.
Deanne Owen Graham.
Yes.
Leetta Felter.
Yes.
Senator Renee Erickson.
No.
And Chair Don Heineman. Yes. Motion is adopted. All right. Any further recommendations for the annual report?
Don, I see Justice Wall has his hand raised.
Oh, thank you. Justice Wall.
Sorry about that. I have an unstable internet connection, so I've been trying to limit my camera use, and I didn't get my hand up soon enough because I think the vote was already taken. But when you're vaping it's a nicotine product. Are they actually vaping tobacco, or am I confusing that based on settlement language that I lost track of? I mean, they're not actually vaping tobacco.
It's nicotine derived from tobacco
Oh, it is. Okay.
Yeah.
So that
And
covers it.
Yes.
Sorry.
No, great question.
All right, thank you, Justice Wall. All right, further input, further suggestions for recommendations for the report. Well, seeing none, Melissa, I guess we're ready to proceed with adoption of the report. We'll do that one more time as a roll call vote.
We would need a motion.
Yes, we do need a motion.
This is John Wilson. I move the adoption of the 2023 annual report as amended.
Do I hear a second?
Lietta, second.
All right, motion has been made and seconded to adopt the report as amended. We will now proceed to a voice vote.
One quick discussion item, if that's okay.
Sure.
Because I feel I was rudely silent earlier after Jessica's comments about the totality of the report. And I just want to say how beautifully designed the report is, and recognize the hours and hours that went into the evaluations that then led into the content to format and write and rewrite and wordsmith and the visuals and all of it. And so I really appreciate the Children's Cabinet team, the KU CPPR team, for the work you all have put into producing the report. And importantly, to the 40, 50 folks listening and who are also grantees and supporters of the Children's Cabinet, for the work that you all do every day to support kids and families that then shows up in the numbers that we see in this report, and ultimately in the improved lives of kids and the people who care for kids. So thank you.
Thank you, John. That's very appropriate to recognize and thank the incredible team that put together one heck of a good report. So thank you for that. Further discussion? Seeing none, we'll proceed to roll call vote. John Wilson.
Yes.
Dr. Tyler Smith.
Yes.
Monica Mernan.
Yes.
Delise Ofen.
Yes.
Deanne Owen Graham.
Yes.
Lietta Felter.
Yes.
Senator Renee Erickson.
No.
And Chair Don Heineman. Yes. The motion carries and the annual report is adopted as amended. Next item agenda, it would be director's updates.
Yeah, we can skip the task force report, Lindsay. I think we adequately covered that during the annual report discussion. I too want to echo my thanks to the team that contributes to the work throughout the year. So it's our external partners, it's our research and analysts at both WSU and the KU Center for Public Partnerships and Research. It is our agency partners. It's my own staff at the Children's Cabinet, and this is a team effort. So thank you for all of the work all year long, the board, your time and attention and interest in the details, drives and lights that fire and makes it all worthwhile. So we appreciate you. I wanted to just give you some quick updates. The preschool development grant, planning grant, has been renewed for, well, not renewed, I'm sorry, that it has been, we were approved for a no-cost extension. That approval just came in a couple weeks ago. In fact, it was last week during Thanksgiving week. We got the no-cost extension approved, which means that rather than expiring at the end of the calendar year, we get an additional 12 months to complete the work that is being funded with that planning grant. That is why we delayed the needs assessment. And then clearly this meeting was shaping up to be lengthy. So our February agenda will include a delivery of the draft of the new comprehensive statewide needs assessment. And then the April meeting is when we intend to bring forward the draft 5-year strategic plan update. So well, that work continues, but we got some grace to really take a lot more detailed time and not have to rush it quite so quickly. The major component that for PDG that is something new and different and not just wrap up of existing work that we're beginning to wind down is I'm excited to let you know that with the no cost extension being granted, we are engaging in an agreement with Child Care Aware of Kansas to grant them a share of that PDG funding that remains available and allow them to pilot the Baby Steps wage support program in Wyandotte County. And just to refresh, the Patterson Family Foundation gave a grant award to Child Care Aware to create the Baby Steps pilot. Patterson catchment areas are rural counties with specific population demographics. So we have seen the success of that program in rural Kansas counties. It is a structured enhancement. It's basically a financial incentive to family child care providers. So those are the providers caring for children in their homes. Those licensed providers their license allows them to care for up to 3 infants. But what research showed that far too many of them were choosing not to take in infants because of the impact that has on the overall, it is that ratio discussion. When you have 3 infants, you are limited in the total number of kids you can care for. So providers often opted not to take infants and focus on older children so that they could have a couple more kids in their care. The incentive is it's a financial enhancement so that you induce change in that behavior, and providers are actually the program is fully enrolled. They have all the providers that they have the budget to provide the enhancement to. And we're seeing an expansion in the number of infant slots available in those communities. So we were curious what would happen in the urban core if we offered this incentive. So we're working with Child Care Aware and the Northeast regional partner, the Child Care Aware resource and referral agent representative in Northeast Kansas is the Family Conservancy. So they will be administering the program, and we are excited to bring you data as that program gets underway to see how we are helping families locate care for their infants. We are also engaged in research over strategies for the efficacy of different strategies for increasing compensation packages for childcare professionals. We have engaged Watershed Advisors as our research partner, and they have done some survey work and they are presenting. They did present their findings to the recommendations panel at the most recent meeting, and the final the results of this effort will be made available, and it will explore, it'll discuss the various options that exist, what we've learned from other states, and hopefully just be a good resource for those who are engaged in the thought process around how we help improve compensation for childcare professionals. We have recently, the family leadership team hosted Engaging with the Experts family roundtable sessions. So in early November, they had those conversations to really take in input from families themselves, and we are excited that on Monday, December 11th, we will have our inaugural Early Childhood Data Summit. We will be rolling out the data dashboard that you have seen, the section of the strategic plan that touches on it, but the fully formed, the dashboard itself will be rolled out December 11th. And so we'll have a series of presentations and summits around the early childhood data in Kansas. So we're excited about that. This cabinet will receive the presentation at our February meeting on the Kansas Early Learning Standards. That team has presented to the State Board of Education at the November meeting. The board had some recommendations, and so the Early Learning Standards team is working to incorporate those recommendations into the draft, and they will bring that back to the state board at the December meeting, and then offer the board chance for final input. And at the January meeting, it is that the early learning standards are scheduled to be voted on by the state board. So then they will come here to the children's cabinet. It will be the cabinet with the hat of, you'll be wearing your Early Childhood Advisory Council hat. And we'll be asking that you also give a vote of approval for the standards. So as soon as the state board has rather than giving you a version that is ever changing, we will get the draft to you with more lead time than normal, because once assuming they're adopted in January, it will give us a couple weeks lead time. So you'll have time to receive them once they've been adopted. So I know they're publicly available now. If anyone's currently interested in the working copy, we can certainly get that to you. The Capital Projects Fund will be the other big agenda item on our February agenda. The application is still open. So speaking to the public at this moment, people have until December 18th to submit their completed applications, and then we will do the formal review process and bring forward a slate of recommended projects for the final round of funding in that program. So we've got a busy agenda coming up in February, and we're looking forward to another few projects in the state receiving funding. We've got $28 million left to grant. As a reminder, we gave $10.2 million at our October 19th special meeting to 3 projects. So these are slightly larger awards to fewer projects than what we saw with the Child Care Accelerator. And they are construction only funding. So that is a peek at the work that lies ahead for us as a team. We are looking forward to a lot of focus on the early childhood sector in the coming year, and appreciate your guidance and insight into the work that we do. And so Dawn, that is everything that I had as part of the director's report. And yes, we actually skipped a different agenda item, which we need to circle back to. And this is very quick, I promise. Lindsay, can you pull the slide up? Early childhood recommendations panel is something we have 1-year terms. You all usually approve that slate. I think it's our June meeting, and then the term starts July 1 goes to June 30th. We can go to the next slide. There is a list of prescribed member seats on the Early Childhood Advisory Council in the federal Head Start legislation. We fulfill that responsibility by the makeup of the Early Childhood Recommendations Panel as our standing committee to the Early Childhood Advisory Council. The Department of Health and Environment has a seat that is required on the board. That seat has been ably occupied by Tricia Wagner from KDHE, but there are some internal adjustments being made to role and responsibilities within KDHE, and they are recommending that Amy Dean Kampmeyer be approved to replace Tricia Wagner to serve out the balance of the term this year. And we traditionally adopt that with board vote. I think, voice vote would be sufficient in the interest of time. It's really somebody who will be inhabiting a similar role within the agency, replacing a staffer whose duties are changing. And then the note that we did have a resignation, but it was a category other representatives as needed. So we did not feel the need to seek a replacement. So that one the resignation is just for awareness. But Don, I do ask for board consent for the change in the roster for the KDHE representative.
Okay, you've heard the recommendation from Melissa to approve the change of representation on the advisory panel for KDHE from Tricia Wagner to Amy Dean Kampmeyer. All those in favor signify by saying aye.
Aye.
Opposed, no. All right, recommendation is approved.
Thank you. That's it. That completes the business for the calendar year. Appreciate you all. Don, back to you.
Thank you, Melissa. I've got to say, between you and Lindsay, you did a good job of mapping out the agenda and using up almost exactly the entire 3 hours. So thank you. Thank you, everyone. We'll see you in the new year, February 2nd. Thanks, everyone.
Thank you.
Bye, everyone. Take care. Renee, safe travels.
Thank you so much.